Order. Questions for oral answer. Question number 1. The name of the Honourable Annette.
Thank you, Mr Speaker. And my questions to the Minister of Health. Does he agree with a statement from the Chair of the PHO Alliance, who said of Budget 2016, quote, primary care cannot deliver essential new models of care within existing and reducing financial resources? If not, why not?
The Honourable Dr Jonathan Coleman.
No, but I thought I'd better go and read the full quote in context. It is from the PHO Alliance, in which they also welcome the bowel screening investment and the increased Pharmac funding. They observe that we have a great primary care system, but they also want more detail on the money. The increase in total primary care funding in Budget 16 is estimated to be around $30 million. This means funding is up $233 million under national, a 35% increase.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Is the $6 million increase in the primary care strategy in Budget 2016 from $180 million to $186 million adequate in light of the Chair of General Practice New Zealand Dr Jeff Lowe's comments that primary care was hoping to hear of 20 to 26 million more a year to address years of funding that has not kept up with inflation?
The Honourable Dr Jonathan Coleman.
And indeed, the funding increase is $30 million, which is greater than 26.
Supplementary question.
Supplementary question, Honourable Annette King.
Is New Zealand Rural General Practice Network Chief Executive Dalton Kelly wrong when he said apart from an increase in ambulance funding, there is little else for rural health in Budget 2016?
The Honourable Dr Jonathan Coleman.
Well, I know Dalton Kelly well, and he thinks this is a very good budget. He would be very pleased, as are many, many New Zealanders, with the $2.2 billion going into health, the $1.6 billion going into DHBs, and many of those dollars, of course, will be spent in the rural sector. So, I don't know, I wonder if you're misrepresenting him.
Point of order, Mr Speaker.
Point of order.
Mr Speaker,
order.
You cannot have a minister say I represent him, and then when I want to table the evidence that comes from a paywall document that's denied
if the member's now seeking to table, that's a different matter, but I'm not, just can't pick what the point of order is that the member's trying to raise.
Point of order, Mr Speaker.
And now, point of order.
I seek leave to table the page from the New Zealand Doctor, which is a paywall document.
Just keep the explanation simple.
It is the New Zealand Doctor magazine, and it is dated the 8th of June, and I correctly quoted Mr Dalton Kelly.
On the basis that this information may not be readily available to members, I'll put the leave sought to table an article from the Rural Doctor magazine, June this year. Is there any objection? There is no objection. It can be tabled. Point of order, the Honourable Dr Jonathan Coleman.
I seek leave to table an article dated the 15th of June entitled King Clutching at Straws.
No, I just need to know. No, I don't need that at the moment. I need to know the source of the article.
It's probably publicly available, to be honest with you, Mr. Speaker.
It sounds like it's a newspaper article. I won't be putting the leave.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
I seek leave to table a document from the New Zealand Doctor. I'm sorry I don't have the date, where Dr Coleman is referred to as Dr No.
No, I think that's not going to help the informed members at all. Further supplementaries?
Mr Speaker.
Order. Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. When was the Primary Care Working Group on the Sustainability of General Practice, which recommended changes to the very low-cost access scheme, delivered to him for consideration?
The Honourable Dr Jonathan Coleman.
A wee while ago.
Point of order, Mr Speaker.
Point of order.
Is that an adequate answer, Mr Speaker?
I think on this case it is. When you look at where the primary question went, it's not a helpful answer, but the member...
It's a smart-ass answer.
Well, the member may conclude it's a smart answer, but it's an answer that has addressed... It is one that has addressed the question. Further supplementaries?
Yes, Mr Speaker.
Order. Supplementary question, the Honourable Annette King.
Does the New Zealand Medical Association GP Council Chair Kate Baddock reflect his position when she said of his decision not to fund changes to the very low-cost access scheme that, quote, there is no new money, we're stuck with the status quo, and with the inequities that represents unless and until we get new money.
A conclusion. The Honourable Dr Jonathan Coleman.
Well, I'm not going to quote on whether or not Mrs Dr Baddock said that or not, but what I can say is VLCA is only 6% of total primary care money. As I've said, can tell you, the money for primary care has gone up $233 million under this government. That's 35%. And when you consider that the population's grown by 12%, that is well ahead of population growth. So there's plenty of money there and plenty of good service as well.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Because there is no new funding to address the inequities in the very low cost access scheme, what will happen to the 600,000 high need, low income patients without affordable doctor's visits, which he said last week, quote, "It's not something the general population is excited about."
Look,
the Honourable Dr Jonathan
once
Coleman.
again, quotes out of context, but look, there is plenty of money that you know there, or one knows, the member knows, there's $2.2 billion over the next 4 years for primary care. If you want to talk about supporting access to primary care, this government has delivered free under 13 GP visits and prescriptions, benefiting 750,000 children and families, something the member never bothered to do when she had the chance, which was a shame.
Supplementary question.
Thank you, Mr Speaker.
Honourable Annette King.
Yes, I do have one. Has he given up on addressing the most pressing need in primary health care, the very low-cost access scheme, when he said to the New Zealand doctor last week, direct quote, "It could form part of a future budget, possibly under a new Minister of Health. I'm happy to do the job."
The Honourable Dr Jonathan Coleman.
Actually, that's a complete misquote. Sorry, but it is.
Order. Question. Order. Question number